Welcome everyone to My Weight World TV. I'm Dr. Brenda MD, and today I'm here interviewing Janice Baker, a registered dietitian with over 25 years of experience. Today we're going to discuss eating disorders. Welcome, Janice.
Thanks, it's great to be here.
Janice, let's start out with the major categories. What are the major categories of the eating disorders?
Well, the major categories of eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder.
Can we go over the definitions of each one?
Sure. The definition of anorexia nervosa is somebody who's taking dieting to an extreme, including self-starvation, extreme loss of weight, and other physical manifestations that come along with it, including hormonal disruptions and other bone disease and other health implications.
Okay, and how about bulimia?
Bulimia nervosa includes somebody who is trying to control their weight by purging the large amount of calories they eat in very short amounts of time. These people go out and buy lots and lots of food, eat it very quickly, and then try to get rid of the calories by making themselves vomit or abusing laxatives.
Oh. And how about binge eating disorder?
Binge eating disorder involves eating, again, very large amounts of food, maybe constantly or in short periods of time, but these people don't compensate for it by vomiting. They typically gain weight pretty rapidly and continuously.
So what are some of the health consequences of each of these disorders?
Well, for anorexia nervosa, the health consequences can include, again, extreme weight loss, which leads to muscle wasting, bone disease. There's often a lot of fractures, blood chemistry levels that are quite off, and hormonal disruptions. For bulimia nervosa, because this includes a lot of vomiting, self-induced vomiting, there can be a lot of tooth erosion, again, a lot of swelling of the cheeks because of inflammation of their salivary glands, and also a lot of blood chemistry abnormalities. And again, both of these diseases and their consequences can lead to severe medical problems and need medical treatment. For binge eating disorder, the medical consequences include, with the weight gain, the appearance of diabetes, heart disease, and other obesity-related chronic diseases.
Okay. Is it possible to prevent an eating disorder from happening in the first place?
You know, in many cases it is. I think one of the most important things is to realize what a good, healthy body weight is. Many of us have very distorted images of what a good shape is to be in. And we see images on the TV and magazines of very thin people thinking that's the healthy way to be, but actually it often becomes quite distorted. And we need to realize that normal weight actually is usually 10 or 20 pounds more than what you see on the TV stars and in the models in the magazines. Also, preventing eating disorders is importantly controlled by eating healthy foods at a normal pattern and a normal pace.
So Janice, what are some of the treatment options for eating disorders?
Well, some treatment options for eating disorders can include a residential treatment facility where people actually live and get treated both nutritionally and medically as well as psychologically for their eating disorder. This can be a place where people can stay for weeks or months. There's also intensive outpatient treatment centers where people don't actually live there, but they go there every day to again get treatment for whatever their eating disorder may be. And oftentimes also there's other options where people will see individually psychiatrists or psychologists, other medical doctor, as well as a dietitian, a coordinated team of treatment so that they can get the different facets of their disorder looked at and appropriately handled. However, whatever the option is, it's important to investigate each program to find out what their long-term outcome is, and also, of course, the insurance details of the programs as well. So again, discuss this with your healthcare provider or your physician to make sure you're getting the right choice for you.
All right, that was excellent. Thank you, Janice.
You're very welcome.
And thanks for joining us today. I'm Dr. Brenda MD with My Weight World TV, and we'll see you next time.